Well, good afternoon, everyone. Thanks for taking some time to tune in today while we do a live Q&A on some very important updates to the MIOSHA emergency rules and other workplace safety tools that you've been using all this year to navigate COVID in our workplaces. Certainly have been a challenging year for sure. I think one of the things I'd like to say at the outset is let's make sure that we are excited about these steps forward. I think for so long now, it's been such a challenge looking forward and seeing that light at the end of the tunnel slowly get bigger, and then finally it gets really big. And we have some work to do yet, so we can't quite cross the finish line, but we're almost there in our fight against COVID. And with a little bit of help, I think that we'll get across this finish line, we'll make our workplaces safe, and we'll be able to move forward in a way that we're all very, very familiar with, and being able to be together, work together and play together in a more open way. And that's wonderful news as we move forward. But as I mentioned, we got a little bit of work to do. So as we look through these updates today, I'm going to do my best to be quick, to be to the point, and to have plenty of time to answer as many questions as we can, because there are some major updates here. First and foremost, as I've been sharing with everybody for the last year, there are some pieces that have been in place for a long time that are critical to preventing the transmission of COVID in our workplaces. And we're going to talk about those today as it relates to face coverings and social distancing. But those tools work. And for those people that are not yet vaccinated, that's why you're seeing a difference between vaccinated and non-vaccinated. And these tools continue to be the most effective in making sure that we don't transmit COVID-19 to each other. Most of the spread of this virus comes from large respiratory droplets that we expel when we talk, sing, cough, sneeze, you name it. And then we can also create smaller things indoors that are aerosols that can hang around a little bit longer. And by wearing face coverings and maintaining that social distance, we're really making sure that we're cutting down on that transmission to a high degree. If we're both unvaccinated and we're both wearing face coverings, some science suggests we cut down on potential transmission by as much as 70%. So that's why you're still seeing these things hang in there as it relates to COVID in our workplaces and our communities, because we need a little more time for vaccinations to catch up. Vaccinations are a wonderful development that I'm going to touch on a little bit more in just a minute, but it's really the key. As I've reported previously, I cover workplace outbreaks, not including schools, colleges, childcare, nursing homes, jails, or prisons, because those have a lot of non-employees. So I really like to focus in on the ones where we would anticipate more than likely these are employees. And I am pleased to report to you this update on workplace outbreaks on the 20th is likely the lowest that I've seen in the last year. And that is great, great news. So we had one reported in office settings over the course of this pandemic. We've seen those range from about 8 to about 16 to 20 in 1 week. Manufacturing and or construction have been high, depending on community outbreaks, and that's very low. And we're seeing the same thing in the retail, restaurants, and bars. As we went through our last spike, these numbers were very, very high. And this is great news, and it's really showing the power of vaccination in our communities to help keep these numbers down. And as we're all seeing, our cases per million continues to fall. We're at 88.2 per million, and our positivity rate's down to about 6.5%. DHHS on this outbreak report is still tracking 305 ongoing workplace outbreaks in the areas that I've mentioned, but we're seeing the numbers trend down, and that is just wonderful news as we continue forward. Now, a few weeks ago, the governor announced the Back to Normal plan, which was based on first dose tracking. So we see this track here of people in Michigan that have received at least their first dose of vaccination, and that's at about 58%. When we talk about workplace safety, I really want employers and employees to understand your workplace. About 89% of the labor force in Michigan ranges in age from 20 to 64. And in this graph here, what I'm showing you is the fully vaccinated rate by age. Now, because we started with those most vulnerable to COVID being older and worked backwards, we're still doing some catch up in the younger age groups. And you can see our average across the working age population is about 42.6% fully vaccinated right now. This is ticking up every day and changed significantly from when I just looked yesterday. So we have some work to do in our workplaces. This could mean that your particular workplace, possibly more than half, aren't yet fully vaccinated. And the CDC made it very clear that the relaxing of social distancing and face coverings is related to fully vaccinated individuals. So these are numbers we need to see continuing to increase to really make sure that our workplaces are safe, and we will get there together. I know that they continue to move up. Younger age groups are moving up pretty well. Let's make sure that we don't taper off here and kind of level off, because this is the real key. These safe, effective vaccines are the real key to making sure we cut COVID in our workplaces and eliminate it from our communities to the best that we can. So let's keep that ball moving forward, but just understand your work environment, because you might not be at the average. You might be way above it. You could be below it, but just try to understand where you're at, because you're still going to need to mitigate the spread of COVID-19 in your workplace. So we did some big updates over the last week. We were starting with the remote work concept. I know that was in the news a lot. MIOSHA had a rule that required employers to create a policy prohibiting in-person work to the extent those work activities could feasibly be completed remotely. We had that in place for about the last year or so, not quite year, last 6 months or so. And we were lifting that rule. And at the same time, we got the CDC updates on things that fully vaccinated people could do. And it was critical that we incorporated that into any updates we did in the emergency rules as well, to recognize the risks in our workplace changing. So you're going to see a less prescriptive, more performance-based MIOSHA emergency rule, which is setting the broad parameters of how we contain COVID in our workplaces and giving employers a lot of flexibility to be creative on how they implement these things. There are certainly some pieces that you have to do, but much of it's going to be focused around the preparedness and response plan, doing those health screenings, social distance and face coverings where required, and training and keeping records. So first and foremost, you've had these in place. If you're an employee, you have seen these. Preparedness and response plans are still required, and they should detail how you're going to mitigate the spread of COVID in the workplace, focusing in on that social distance, face coverings, and good hygiene. And this could include those engineering controls, administrative controls, how you're cleaning, some of the PPE you might need, health surveillance, and training. You're still going to need those workplace procedures. So you need to identify one or more workplace COVID-19 coordinators. Make sure you're updating your policies based on this update to the emergency rules, mandating face coverings for those that are non-vaccinated, training new employees on procedures, and then keeping up that health screening protocol. The workplace procedures for cleaning in the MIOSHA emergency rules were updated to tie in directly with the CDC guidance. That has been updated just a couple of months ago, and that includes just focusing on those high touch areas and then disinfecting following a positive COVID-19 person in the workplace. For sick employees, you're still going to conduct those daily health screenings. One question we've gotten already is, do you need to do health screenings for vaccinated people? And the answer is yes. You're still trying to catch those symptoms and keep it out of the workplace. So, and make sure that you continue to have employees report if they have symptoms or a positive test. You're still going to need to isolate employees that are exhibiting symptoms and not allowing them to return until they meet the return protocol set by the CDC or local public health. Make sure you're doing that employee training. And one of the updates we did do in the rules is that as part of this training, make sure you include information about the available vaccinations for COVID-19. On the social distancing piece, we're going to spend a little more time on this and the face coverings, because we did update the rules to reflect the CDC guidance. But employers shall ensure that any employees, except those fully vaccinated, remain at least 6 feet from one another to the maximum extent feasible while they're on the worksite premises. And likewise, for face coverings, employers still need to provide non-medical grade face coverings, but they're not required to provide those to people that are fully vaccinated. A couple of the questions we were waiting on for the science to catch up that the CDC answered regarding vaccination was, what is the likelihood that you can get sick? And what is the likelihood that you can transmit this virus if you do get it and you're vaccinated? And they said it's very low on both. So that's why you're seeing such significant changes in this space. If you are vaccinated, you are very unlikely to get sick. If you do get the virus, what they've said is that you're very unlikely to exhibit any strong symptoms. And it's very, very unlikely that you'd be able to transmit it. So that's why you're seeing these changes. So then you have to provide those face coverings, but not necessarily to those that are fully vaccinated. And employers still need to require non-vaccinated persons to wear face coverings when they cannot consistently maintain 6 feet of social distance indoors. CDC made a distinction between being outdoors and being indoors. Certainly, if you're outdoors in large groups, you're going to want to consider wearing those face coverings. But in our workplaces, when we're outdoors, it's unlikely that we're going to be in large groups. So this is focused on indoor environments. And keep in mind that the CDC also noted that in certain settings, healthcare settings where patients may be present, using or riding in an airplane or public transportation, even fully vaccinated people still need to wear those face coverings. And that's typically because of density and other things that are going on in those spaces. In ways that you're going to see this implemented is going to give a lot of flexibility to employers to figure it out, but it has to be effective. And there are several ways, and we've had discussions with employers all across the state and employees. There are many ways employers are going to manage this. That can include asking employees if they're fully vaccinated. Many employers I've talked with are adding that question to their daily health screening protocol, many of those through an app that employers are using to answer those types of questions. It could be in the work area where the employees are, posting work posters to make sure you're reminding employees to keep them on after you've determined that they can be in there. You can obviously continue to allow remote work for those folks that may not be vaccinated, and employers can just require face coverings and social distancing for all employees, regardless of their vaccination status. Some employers are taking that tack. And one note on the remote work rule that we've lifted is that remote work continues to be recommended as a mitigation strategy by both federal OSHA and CDC. That's not a requirement. It's just a recommendation because it decreases congregation in the workplace. As we talked at the outset, congregation is where we see a lot of spread, a lot of the challenges for employers. So it's a strategy that you're going to want to consider continuing if it works in your workplace. And to help with this, we conducted a return to in-person office work group over the last several weeks with large business, small business, public health, municipalities, state employees, K-12, and really talk through different challenges for employers and their employees in the workplace. We also did 6 additional stakeholder meetings and legislative updates on that, and we focused in on physical workplaces, HR policies, vaccinations, and employee support. Great recommends there on our COVID Workplace Safety website around this space. As again, these are recommendations kind of highlighting the challenges for both employers and employees. Let's not forget that employees have been struggling through this crisis as well, and we're still seeing continued challenges with childcare and caregiving. Some of the transportation might not be as available as it was prior. We're moving in the right direction, but there are still challenges there. Just want you to be mindful of that. And a few reminders. Face coverings protect others from you. They're not intended to protect you from others. So when you're thinking about your workplace strategies as an employee or employer, just keep that in mind. Now, CDC has said that face coverings can provide some degree of protection, but the general intent is to protect others from any aerosols or large respiratory droplets that you're putting out there. And don't forget that not all employees will be able to get vaccinated. We're going to have friends, family, and coworkers that for some reason cannot get this vaccination. And we're going to need to be mindful of where they're at in this fight against COVID as well, and how we're making sure that we protect them. And finally, MIOSHA establishes minimum standards for employers. So while these are performance-based, employers can go higher. So as I mentioned, an employer can choose to just continue following the mitigation strategies of social distance and face coverings, regardless of your vaccination status. And some workplaces will choose to do that. And I'm so proud, and I just want to highlight a few things over the past several months that the MIOSHA team has been doing to protect employees, to educate employers, and make sure that we all get through COVID together. We developed a one-stop online resource at Michigan.gov COVIDWorkplaceSafety, where you're going to find updated information now regarding the emergency rules. MIOSHA implemented 5 state emphasis programs to focus on industries that needed more support and observation. We developed an ambassador program to provide one-on-one consults with open to the public type establishments, gyms, retail, and others. We've done about $6.5 million in grants and are about to launch a second phase with another $2 million or so in grants to employers to help with purchasing workplace protective equipment. And we have a great hotline for you that I'm going to touch on again next to make sure that employers and employees understand how to get this information. The Ambassador Program was launched last October in partnership with NSF International. We originally focused on restaurants, bars, gyms, fitness, small retail, and some office. We expanded that out to child care centers. We had a shorter tier 1 consult and a longer tier 2. If you participated in the tier 2, you got that wonderful window decal there that is across the state of Michigan. The program has done around 4,000 free consultations across the state of Michigan and is working to help employers understand the tools that they may need to implement while giving confidence to customers and parents that these establishments are going that extra step and doing everything they can to make their workplaces safe in light of COVID. In that hotline, MIOSHA launched it right at the outset, is at 855-SAFE-C19. If you have questions around COVID workplace safety, whether you're an employer or employee, the average wait time throughout the crisis has been somewhere around 30 seconds to get to the MIOSHA experts, and they are answering questions for everybody. And if they can't help you there as an employer, they will get you over to the consultation team. And if you're an employee and it's necessary, they will get you over to the complaint side of MIOSHA to make sure that you are being heard. It's a great tool, and thousands of calls have come in, and definitely encourage you to take advantage of it as you're working through your return to work strategies and things that you're trying to do in light of these recent updates. And I lost my screen. There it is. So with that, we definitely wanted to make sure we left plenty of time for questions, and we will do our best. I may not be able to answer them all, but we'll make sure that we do our best. But in light of all that, just again, let's not lose sight of the fact that while we have some work remaining, this is a huge step forward in our fight against COVID. And we're continuing to see vaccination rates go up, which should continue to pull case counts down. And we've seen that directly impact our workplace safety and health. So definitely encourage all employees to get that vaccination. If you're concerned about your safety at work and you are able to be vaccinated, that's how you do it. And definitely encourage employers to keep providing that information to employees because that's how we will make our workplaces safe.
All right, lots of great information, Sean. Hi, everybody. My name is Erica, and I'm going to be reading off some of the questions that you guys are submitting now. If you haven't already, we'll try to get to as many as we can, but I see we've already got quite a few in the queue. So with that, the first question is from Peter, who asks, can we collect and file a copy of an employee vaccine card?
Absolutely. Employers are going to have a lot of leeway on how they manage relaxing standards if they choose to do that. They do have to find a way that in good faith will ensure that those that aren't vaccinated are wearing face coverings and socially distancing. To the best of our knowledge, that's perfectly fine for an employer to ask and get that information and file it away. As I mentioned, many employers I've talked with are adding it to their daily health screening protocol, whether that's on paper or in an app. Some are doing, yes, no's, all that kind of stuff at the door so they can manage it. And I would keep in mind for employers especially that most of the questions about who's vaccinated and who is not are going to come to you first, and you're going to want to be in a position to manage that. So however you determine that's going to work for your work location, understand that you're going to have to manage those expectations as well.
Perfect. And should employers have employees take temps and answer COVID questions every day before work?
The daily health screening protocol continues. The goal there is to make sure that if symptoms are identified, we can keep it out of the workplace. When If you talk with MIOSHA on the hierarchy of controls, eliminating the hazard from the workplace is the most powerful tool you have. And the daily health screening is intended to identify quickly and isolate people that may be exhibiting those symptoms. We have taken out any requirements for temperature screening from these updated emergency rules, although if employers are doing that, certainly can continue to do that if they find it works.
All right. And are people who have recovered from COVID considered vaccinated, or how do the new rules apply to them if they are or are not considered vaccinated?
Yeah, so there are some quarantine pieces that relate to if you've had COVID within a certain amount of time. So fully vaccinated people do not necessarily have to quarantine, which means they don't have symptoms, they haven't been tested positive, but they had a close contact with somebody that has COVID. They don't necessarily need to quarantine now within a 3-month period. There's a similar set of recommendations and the rule for those that have recently had COVID and being able to avoid quarantine periods if they've had a close contact. But the CDC update was very specific to fully vaccinated individuals. So the rules distinguish between fully vaccinated and non-vaccinated. Fully vaccinated, of course, meaning that you've had either one of the J&J or both of the Pfizer and Moderna shots, and you're 2 weeks past your last shot in whichever protocol that you went on. It doesn't make any reference to those that may have previously had COVID.
Thank you. And how long must we retain the daily screening sheet?
Excuse me, I talk so much I had to take a little drink. So updated in the emergency rules was a requirement to maintain records for 6 months. The record keeping requirement includes the training pieces that you had in there, as well as that daily health screenings for a 6-month period.
All right, and Lisa's question comes in with, the rule says employers can keep records of whether employees are fully vaccinated. Can this list be shared with frontline supervisors who will be managing enforcement?
So our understanding in MIOSHA and in their FAQ is that that's not protected health information. I think there are some guidance pieces from the EEOC on the extent that you may be able to share that, but simply vaccination status does not get into medical issues. It's just a yes or a no. So I think employers would be able to manage that in a way, but definitely want to check in with their own legal counsel the extent of the information that they may be providing. But I think the log sheet of yeses and nos would not contain any health records.
All right, and this one comes from Jan. First question I'm not clear on is, can a vaccinated employee work in the same small office 4 feet apart as a non-vaccinated employee without a mask all day? Or must the non-vaccinated person wear one with all persons?
So the rule requires non-vaccinated people, it doesn't differentiate between who you're sitting next to. If they cannot consistently maintain 6 feet of social distance, they're going to be wearing that face covering.
All right. And is there an end date in sight for temperature checks for employees and customers?
As I mentioned, when you on the updates to the rules, which I don't think I highlighted too much, all of the industry specific pieces that were listed separately prior are no longer in the rules. And the temperature screening pieces that were included were also eliminated from the rules. So employers can choose if that's an effective method for them to try to identify and eliminate that hazard. If it is and they want to keep it, they're more than welcome to do that. As I mentioned, MIOSHA is a minimum standard. If they are in a position where they don't want to continue temperature screenings, they don't need to do that either.
All right, and what do you do if staff or residents refuse to wear a mask indoors? So
the MIOSHA emergency rules are really related to the employee-employer relationship. I think this is one of the challenges with COVID is that it's a public health crisis that impacts workplace safety. So you're going to look at some of the DHHS information with the extent to which sort of customers and visitors and others might be wearing face coverings. I think that it's important for employers to use their management discretion to ensure that employees are following the rules and using these safety mitigation strategies the way that they're supposed to.
All right, and beginning July 1, all broad epidemic orders will be lifted. What exactly does that entail? Will all mask requirements be removed for vaccinated and unvaccinated individuals?
So that announcement was actually related to how MDHHS is working with the governor to manage the public health crisis. So we don't have a direct line to where they may be looking at on the epidemic orders. One distinction I would suggest is that when we talk about workplace safety and public health, MIOSHA issues emergency rules and standards that deal with the employee-employer relationship. And I think one of the considerations there is that as an employee, you do not necessarily have the same freedoms as a customer. So if your workplace is unsafe, you need to report that and seek compliance through MIOSHA in that manner, but you're not going to necessarily be able to just leave, and the employer is going to manage your environment much more so. So we can't comment on the epidemic orders in July 1 because that's in the public health space.
All right, and can we segregate employees by vaccination status?
That's a great question, and I think one that I wouldn't want to try to answer off the top of my head. I would definitely want to look at the EEOC guidance. They have a great FAQ. Frankly, if you just Google EEOC COVID, there's a long Q&A that they have been doing all throughout the crisis on questions related to the Americans with Disabilities Act and how that may apply in certain situations. And more than likely, that's a question that they have answered in that space.
All right, and can you please explain what healthcare setting where a patient may be present means? Should employers use the CDC definitions? And does it matter if a patient is actually present? What about shared patient, non-patient spaces?
So the MIOSHA rule is using the CDC definition of a healthcare setting. So I think it's where patients may be present. I think in certain healthcare settings, you're also going to be looking at other CDC or other information that's very, very much more detailed. And I would definitely encourage that person to call into the hotline to make sure they discuss those issues, because while I did a general overview of the rules, healthcare settings, healthcare environments have their own sort of list of requirements that they have to meet. And I think we'd want to definitely dive in a little bit deeper there.
Perfect. And this next one is submitted from John. How do we verify a customer has been vaccinated? Is it just using the honor system?
So under that would fall under the DHHS epidemic order. And I would tell you that while we don't generally interpret those, that is the general gist, is that you can post a poster instructing unvaccinated people to wear face coverings, or in the alternative, fully vaccinated people don't need to wear face coverings.
All right, and Emily asked, can physical barriers be removed? What kind of distancing is required for guests at bars and tables at restaurants?
So employers are going to have flexibility within their own plans now, in their preparedness response plan, on how they're thinking about how COVID spreads to determine if barriers continue to be necessary in certain environments or certain spaces. It depends on the exposures to the employee. I think you'll want to consider that. In some places, probably not. In others, maybe. I think it also depends on the vaccination status of your staff. If that person is fully vaccinated, I think CDC said very clearly that they're not likely to get the virus. So there may be differences there that you'd want to manage as well. And we took out the industry specific requirements for in the emergency rule update. So we no longer have those requirements that include table separation, how you manage customers, and some of those types of things.
Perfect. And Charlene asks, do you have any recommendations regarding screening questions for fully vaccinated employees?
So at this time, and I've been looking because we get the question, CDC hasn't updated any of that information as it relates to fully vaccinated person. So the expectation right now, and let's keep in mind, I mentioned we're going to see a lot of changes over the next several weeks as it relates to COVID and vaccinations, that you continue to use the same health screening protocol.
All right. And if Michigan is fully open with no COVID restrictions starting July 1, will MIOSHA also remove all emergency orders on July 1?
So as I mentioned, I think we're going to be watching the science and updating accordingly. There are some differences between the workplace and sort of just going shopping, where you're going to be in the workplace for longer periods of times. You're going to have less control of it as an employee over how you manage your safety within the work environment. The employers are going to have more control over how that safety is managed in the work environment, and we will have to see when we get closer.
All right, and this one's from Becky. Workers that have unvaccinated children at home are leery about being in a workplace that has no masks. How do we address this?
So one of the things the CDC said in their update, and I think I'm inferring from the question that that person has unvaccinated children but is fully vaccinated themselves. That's the key to both your workplace safety, and as I mentioned, CDC has said it's very unlikely you would be able to transmit COVID if you're vaccinated as well. So understanding that we have concerns about our friends and family, especially our children or our parents, if they're elderly or vulnerable, or other people in our lives, that we definitely want to manage that we're not going to be carrying that from one place to another. I think that employers have that obligation to provide that safe workplace, and they're going to be working hard to make sure that people that aren't vaccinated are wearing those face coverings to make sure that the workplace is safe, and makes it very unlikely that if you are vaccinated, you would get sick and bring it home.
All right, Sean, we're going to squeeze one last question in. This one is from Scott, who asks, are sites still required to have a COVID supervisor on site at all times when work is being done, or just on call?
We modified the rule to remove the on-site at all times requirement. So employers still need to designate one or more COVID coordinators, and many employers with multiple locations are continuing to have multiple coordinators depending on where they are. Keep in mind that the coordinator is sort of your answers and eyes on the ground, but you do not have to have that person necessarily on site at all times. And as that was the last question for today, I would just like to take a minute to sort of wrap up. I really appreciate you spending some time with me this afternoon to kind of look at these huge updates to where we're at in our fight against COVID and how we're applying that to our workplaces to make sure that we continue to have safe workplaces while recognizing where we're at as it relates to vaccination and COVID. CDC gave us some wonderful news. I think certainly earlier in the year, watching the spike and things that were happening, I think it was hard to look forward and see a brighter day coming, but that brighter day is here. We have a little bit of work to do to get to the end of that tunnel. As I've been saying, it is you're at that spot in the tunnel now where the sun's hitting your eyes, but you're not quite there. We're right there, and we need to make sure we keep pushing up those vaccination rates. As I showed you, understand your workplace. The working age population fully vaccinated rate is lower. It's 42.8% collectively, and then within different age groups, it might be higher or lower. That is great news, but we got to keep driving that up to really make sure that we've contained COVID and make our workplaces safe. So we have a little bit of ways to go in that tunnel, but we are going to get there together. And then for employers, sort of the last note, as I mentioned, employees have been fighting through this crisis right alongside you, and there's going to be some challenges, especially for those in-person, in-office workers that I want you to be mindful of that with childcare and other things. I know you are. I'm just throwing it out there. We have great recommends from that work group that can help you kind of navigate some of those tricky questions. And you know, we're doing it together. We're going to get there together. Very, very excited to provide this update to you. I think we're all relieved that we're moving the right way. Still need to mitigate COVID in our workplaces, but all in all, a great step forward as we move towards summer. So thank you so much for joining us today, and I hope it was helpful.